Are you waiting around to fix your hearing because you think Medicare is going to pay for it? If so, you need to stop waiting right now. A lot of people just assume that once they hit a certain age, the government covers their hearing aids. But here's the hard truth. Original Medicare doesn't cover them at all, and it hasn't for decades. It honestly makes no sense. Medicare handles your doctor visits, surgeries, and so much other healthcare, so it feels like hearing should be a no-brainer. But since the system is broken, you have to know how to beat it. Today, we are skipping all the confusing government jargon. We are breaking down exactly what Medicare actually covers, the clever workarounds you can use instead, and how to get a much more affordable path forward today. Let's start with the plain facts. Original Medicare, which is your Part A and Part B, completely excludes hearing aids and fitting exams. You are on the hook for 100% of those costs out of pocket, a rule that hasn't changed since 1965. There is one narrow exception. Part B will cover a diagnostic hearing exam, but only if your doctor orders it to check on a specific medical issue. Even then, you have to meet your $283 deductible first, and then you still pay 20% of the cost. This is strictly for medical diagnosis, not for getting a hearing aid fitted. If you just want a routine test to check your hearing levels, Medicare won't cover it. You might hear that things like cochlear implants are covered, which is true, but only because Medicare classifies them as surgery-based prosthetic devices. For the vast majority of people just dealing with a mild to moderate clarity gap, that loophole isn't going to help. But this is where things get a lot more useful, because Medicare Advantage plans play by a completely different set of rules. These private insurance plans, also known as Part C, are required to cover everything standard Medicare does, but they can add extra perks, and hearing aid coverage is one of the most common ones. In fact, nearly 97% of these plans offer some form of hearing benefit. Just keep in mind that they don't all cover things the same way. Usually, a plan gives you a specific dollar allowance toward the cost of the devices. If your hearing aids cost more than that limit, you pay the difference out of pocket. Plus, these allowances reset every year, meaning any unused money won't roll over. So while these plans definitely help, they rarely cover the entire bill. To see what is available near you, you will need to check a plan's specific evidence of coverage document or call the provider directly, since these benefits change completely based on your zip code. Now, if you don't have one of those plans, you might be hoping the government will step in soon. There has actually been a big push in Congress to fix this massive coverage gap with a bill called the Medicare Hearing Aid Coverage Act, or H.R. 500. It is a piece of legislation designed to finally force Medicare to cover hearing aids and fitting exams. But here's the honest truth. Even though lawmakers have introduced and reintroduced this bill for years, it still hasn't passed into law. There is no guarantee or clear timeline for when or if it ever will. If you have been holding out on fixing your hearing because you are waiting for Medicare to step in, that wait has already lasted way longer than most people ever expected, and there is still no end in sight. But here is the good news, and it is the part that matters most. A landmark FDA rule completely changed the game by creating a whole new category of over-the-counter hearing aids. Now, any adult with mild to moderate hearing loss can buy hearing aids directly, completely skipping the doctor visits, prescriptions, and audiologist fittings. This is massive if you are on Medicare. Instead of dropping $4,000 on traditional prescription devices, you can get high quality over-the-counter pairs, starting at just a fraction of that cost. The gap between what Medicare won't cover and what you actually have to pay has officially narrowed. There are also a couple of extra avenues worth checking out. If you have a health savings account or a flexible spending account, you can buy hearing aids using pre-tax dollars. Plus, depending on where you live, some state Medicaid programs offer coverage for qualifying low-income individuals. Waiting on Medicare to cover hearing aids is a completely reasonable instinct. But this gap has existed for 60 years, and the bills to fix it keep stalling. That is a long time to put your conversations and relationships on hold for a policy change that might never arrive. The good news is that the massive cost barrier that made waiting feel necessary has completely changed on its own. If you are dealing with a mild to moderate clarity gap, check out our product, the Hear Direct Club Nova, linked in the description below. If you use the code YT10 right now, you will get 10% off your order. We engineered the Nova specifically for this range, allowing you to bypass clinic visits, insurance paperwork, and high costs. To show you exactly what a difference it makes, listen to a typical conversation before using our device, compared to what it sounds like with the Nova turned on.
This is a demo of Nova in a busy restaurant setting. Use the buttons below to switch between hearing with Nova and without Nova.
It really is that simple to get your clarity back. If you want more honest, practical guides like this to help you navigate your hearing health, make sure to hit that subscribe button.